So after cancer treatment, many patients experience long-term side effects, both from their cancer diagnosis as well as the treatments they receive for their cancer. In addition, there's a significant amount of anxiety often for patients as they are considering the possibility of recurrence. And many patients experience other health effects, including increased risk of cardiovascular disease, and weight loss and nutrition becomes a very important issue in these patients. So we really have to consider the patient in a holistic approach and consider their psychosocial needs as well as their long-term health goals in addition to their cancer diagnosis. And I think that's one opportunity where supportive care plays a large role in these patients.
Thinking about a cancer diagnosis or any diagnosis of an illness that changes your life, one of the things that is very important is to think about the family dynamics and the psychosocial, because we hear it very commonly, and our patients and our culture will tell us that once you receive a diagnosis of cancer or again any illness that may have a life-limiting effect, your life changes. But it's not just the life of the patient, the life of the family changes. And having the interdisciplinary approach that honors the patient and the family and the effects on the family is key. And that is one of the aspects of the survivorship programs and really one of the maybe unrecognized effects that the illness can have on the larger family in addition to the patient. Not only clinically does UAB offer the supportive care and survivorship clinic, but there are active programs in wellness, there are active programs in management of some of the other specific long-term side effects of the cancer treatment, such as, for example, in breast cancer patients with lymphedema, specific physical therapy or massage therapy programs for that population and some of the late effects. There are many other programs and centers that not only offer clinical expertise to help with the aspects of long-term management of the effects of cancer or other diagnoses, but also active research and education, ongoing support groups, things that can help patients and families again through the stages of their acute illness, but also through the long-term side effects and survivorship issues that they may encounter. And this is the commitment that UAB has made, again, as a national leader in this area.
The partnership between UAB and the community is very important. It's critical that we have excellent communication between UAB and the community to ensure that patients have a smooth transition and that they're receiving the support that they need from their primary care physicians as well as from the oncologists and their palliative care partners.
We certainly recognize that throughout the Birmingham area, throughout the state of Alabama, and really throughout the South and nationally, that our primary care physicians, that our primary oncologists are the focus of care and the important components of treating patients with cancer and other illnesses. But UAB can make specialty services available, and we can also share best practices with our primary care physicians and the other cancer treatment centers throughout the Southeast in order to help them also build the support network, the resources, the particular clinical programs more locally that may help their patients and families in their community. So partnership is really key and important.
So as a tertiary care center, UAB has the ability to offer additional services, particularly for very complex patients. So there may be some patients that have a unique diagnosis or a particular complication where there may be more experience with that at a tertiary care center. In addition, the research component of what we do at UAB is very important. So in oncology, we have access to clinical trials, which may offer additional options for patients. And so I will often have patients that will see me and my practice for clinical trials, and then we'll go back to the community for additional treatment after they have participated in a trial. And this additional research expertise can really add to the patient's experience.
So like Dr. Rocque said, besides the research and the opportunities for patients to enter clinical trials which may not be available in their local area, provision of palliative and supportive care services in the clinic can also complement as far as an opinion or a treatment plan that can help the patient's primary oncologist or primary physician once they return back to their more local location of care. So such things as opinions about complex pain management, complex psychosocial issues, some of the issues around depression, anxiety, that we can provide a specialist opinion and assistance with the care plan and then partner with the referring physician in order to take the best care of that patient. That's really important, and that would be what we would offer here that would help complement and augment what the primary care physician or oncologist is able to provide for the patient and the family once they get back to their more local treatment area that they may not have access to.
And additionally, that partnership can really help the patients feel more confident about the treatments that they're receiving in their home community, that they've had that second opinion or that additional input from UAB.
Right. So one of the aspects of palliative care that we're beginning to see now in the research that's very important for the future is that there are some early indications that providing supportive care and palliative care earlier in the diagnosis and the care plan of patients who have an advanced illness may actually lead to increased length of life, increased survivability in partnership with what we would consider the more traditional therapies. So for the future, that's an important message, that living longer, but also living longer with improved quality of life, the partnership between our referring physicians, oncologists, palliative and supportive care is crucial and one that you'll hear more about.
And those studies really highlight the importance of getting palliative care involved early, and that this is something that can be done in conjunction with standard oncology care and chemotherapy.
Right.